Hi guys, Sydney here in the AAFE Training Center. Today we have a Botox case. We just did some filler on this patient, so you can see she's a little red down here. You can pay that no mind, but she's nice and smooth there now, so we're really happy with those results. Moving on to her Botox treatment. So I did already clean her, of course, makeup off, alcohol. She looks nice and clean, and I'm gonna mark her up. So go ahead and turn slightly towards me and raise your eyebrows for me. I'm marking my lateral borders, relax, and raise again, and relax. Always avoiding, this patient has really nice deep set eyes. She has a nice brow bone to kind of support her frontalis muscle, but I am still going to avoid that bottom 1/3 of her frontalis so that we don't drop her brow, because no one likes that. I'm then going to place my dots where I want them, raise. Good, I have nice good coverage of that forehead muscle, frontalis muscle, excuse me. Angry for me, moving on to glabella. Good, so procerus I'm gonna mark and relax. And angry again, I'm gonna mark where those tails seem to attach and relax. And then I like to kind of feel it. And I'm gonna place my medial and lateral corrugator dot right there. Neuromodulators work best on the insertion and origin of these muscles, so that's what we're trying to get close to. This marking, it appeared that it kind of tailed off there. It's more about here, so I always like to double check. And then we're gonna mark up for a brow lift. Go ahead and close your eyes really, really, really tight. You can see here, relax, and close really tight, her orbicularis oculi pulling. So that's where I'm gonna go, and turn this way, and close really, really, really tight. Where it's pulling, I'm gonna treat that uppermost portion of that orbicularis oculi muscle. And I'm gonna give her more on this side because she's a little bit lower at rest. And relax, good. And smile real big for me. And relax. Here, I'm feeling the edge of that orbital rim, which is really close to that lateral canthus, and then I'm going about a finger width away from it. So, I'm gonna have actually, smile real big for me, and relax. 3 injection sites on her, and I'm following the way that muscle moves with my injection. Smile real big, and relax. And holding this tissue taut, I'm going to slide just the bevel of my needle in, little poke, and give a little bit of product. When you're in the muscle, you'll feel your needle kind of slide in. Of course, trying to avoid any vessels that are very apparent, but of course bruising happens with this. I try to stabilize on the patient's face somewhere. If I meet some resistance, it's usually, turn a little bit towards me, because I'm either too superficial or too deep. So I just adjust so that it's right in the muscle. All right, moving on to glabella. Go ahead and make an angry face and relax. I always have them express and make those faces, but then I like to inject in a relaxed muscle. It's less painful. Angling up and away here and supporting that orbital rim. And I like to hold pressure here for just a second so that we don't leak any product into an unintended area. And I already went over education with this patient. She knows she's not going to lay down, touch her face, or sweat for the next 4 hours. She planned ahead and worked out prior. A little bit of pressure there. I'm going to move on to that brow lift. So turn away from me slightly and close your eyes really, really, really tight. And relax, and close really, really, really tight. And relax. I'm going to come out just a bit laterally, a little poke. Perfect. And turn that way for me slightly. Close really, really tight. Good, and relax. I'm going to catch those orbicularis oculi muscle fibers, very superficial. Good. And now we just have her crow's feet to treat. So those are those horizontal lines that come out from the eye. the muscle fibers at this point in the muscle are running vertically, which is why we see those horizontal lines. Smile real big and relax. So we're going to target this area right here. If we go too far down the cheek or too far out laterally, we're bound to hit an unintended muscle. So we kind of stay tight to the eye without going too close to that lateral canthus. And turn towards me. Perfect. Now you can see here she has a small vessel, so I'm just going to try to avoid that. And this product will take 2 to 10 days to take effect. I'll see her for a follow-up. We'll make sure she likes her results. Thanks for stopping by, guys.